Welcome on to our next video. Today we are talking strength and conditioning training when it comes to shin splints. It's a very common running injury, particularly with beginner runners, and we're going to be talking about some of the things you can do from a strength and conditioning perspective to prevent and treat shin splints as a runner. My name is Brad Brown. I'm from CoachParry.com, where we help runners like you become fitter, faster and stronger. Going to be joined by our strength and conditioning coach Shona Hendricks today. We're also going to be talking about a strength training program, and if you'd like to download it, you can right now. The link is on the screen. Just click on that, download it, listen to the video, and let's get those shin splints sorted. Welcome back to our strength and conditioning coach, Shona Hendricks. Shona, nice to have you on again. We're talking shin splints today, and in particular with shin splints with regards to strength and conditioning. Often you'll pick up an injury and everyone says, oh, you need to do strength and conditioning. Is shin splints one of those injuries that S&C helps with?
Yes and no, not directly. I mean, shin splints essentially is mostly when you have a bit of an imbalance between the posterior and the anterior sort of compartments within your lower limbs. So let's in English again, let's put that in plain terms. That's the shin. So you have a whole load of muscles in the front of the shin and your calf at the back, the posterior sort of aspect. And when you have an imbalance there, yes, that you're at a higher risk for shin splints. But really, mostly shin splints is caused from an overload issue. So too much, too fast, too soon from a running point of view. We can obviously do some things that can help prevent that in the long run, and in particular with a beginner runner. If you're starting out, the first and foremost thing is to make sure that you're not doing too much too soon and too fast. But yeah, there is some strength work that we can look at. There's a muscle in the front of the shin. It's called the tibialis anterior, and that tends to be the muscle that people worry about, or that gets very tight and starts to spasm. But that muscle, unfortunately, isn't really there for shock absorption. So when people say, "Can we do strength work for shin splints?" It's by strengthening that muscle. That muscle is really responsible for bringing your toes up. If you're pointing your toes up, not pointing them down, what we call dorsiflexion. And really, if you're strengthening that muscle, all it's going to do is make you better at dorsiflexion. It's not actually going to prevent shin splints. So, we can do some things. I would recommend strengthening, some of your pelvic stability and your hip girdle and glutes, and definitely a lot of the interior or inner thigh muscles, so your abductors. Again, we've spoken about this so many times. Everything works in a chain, and I think if you're getting shin splints, it's not an issue that's connected directly to the shins. It could be something that's happening up above, so more towards the hip or the knee, or even something that's lower down, maybe perhaps with your shoes and your running gait and the way your foot works as well.
And it's like you said, Shona, it's very much an injury that's caused by doing too much too soon, and the best way to temper or stop that happening is to build up slowly. And the same thing applies to strength training. Obviously, if you're thinking you want to try and strengthen for shin splints, you've got to be careful not overloading that you end up causing other problems by doing that.
Yeah, definitely. So if you are going to starting definitely with body weight, and then slowly progressing from there, starting with body weight maybe once a week, progressing that to maybe body weight twice a week, and then you can start progressing in terms of load and weight, and maybe 2 or 3 times a week of training. But it is so key, and with this injury in particular, I mean, some people argue if this is even an injury, but it's very debilitating for runners because it is so painful, and so the number one thing would be rest, and then doing some strength stuff to help combat it can be effective, because again, talking about a chain, the more strength work you do, the changes your biomechanics and your gait. And what we've seen as well is that a lot of in the way that people, where they're heel striking, that tends to be where this can sort of get exacerbated. So, perhaps working on some strength stuff to combat that poor biomechanics work would be key.
Shona, what are some of the exercises that you can do? I know they're probably quite general in nature because we're trying to strengthen the entire chain. What are some of the exercises that you could do that would benefit an injury like this?
So, depending on where we're looking, whether the person's biomechanically poor or strength-wise poor from a hip point of view, you're looking to do exercises that strengthen the inner thighs in particular, so abduction. So A lot of side planking would help. Side planking with a bit of a leg lift, that's always a good one. Anything in and around the core and the glutes, that pelvic stability is really, really key. And then if we're looking further down, if we're looking at the feet, you want to be fixing things, what we call foot intrinsics. So we call them like toe pulls. You lay a towel out and you try and you pull the towel closer in with your toes. That's really, really key. Good calf raises where you're putting the pressure on the inside of your foot. So we're trying to start stabilizing, increasing the strength of those stabilizers, more your soleus muscle, which is the calf below the gastroc, that big muscle in your lower leg. So that would be key. And then if you have done a bit of strength work and you are quite familiar, I would suggest a little bit of skipping. Just that light sort of plyometric work or ballistics type training is really, really effective as well.
As far as foam rolling, does foam rolling help something like shin splints?
Yeah, it does. It's I think it's a relieving mechanism. So we're always quite specific about what we would recommend. So if you're in a lot of pain and it's very debilitating or very symptomatic, I'd recommend seeing a physio and your medical professional. They know exactly how to release that and will probably be more effective than you foam rolling it. It's a difficult area to foam roll. Normally, if you sort of sit on your knees on the foam roller and you're putting your whole weight on, and it can be very sore, as most foam rolling is. But again, from a maintenance point of view, yes, I think that's a great idea. Maintaining your foam rolling after every sort of run, and perhaps even once a week massage therapy, I think is also a winning idea.
Thanks for joining us on this video. Don't forget, if you don't want to miss any of these videos that we put out, hit the subscribe button over here. You can catch our latest video over here, and one of our most popular is over here. And also, if you want to shave 10 minutes off your PB, all you need to do is download our free strength training program. You can get that right here.